between 1990 and 2005, we did about 100 aortic valvuloplasties to say that we will do a balloon to the patients who are inoperable. And only 100. And in that much time, we probably did 15,000 aortic valve replacements. So when initially this aortic valve option became available, transcatheter valve, we sat down with our surgical colleagues and us, and we were all debating whether really, where are these patients? Where are these patients that we are not really treating? Because if we are only treating 100 patients in 15 years, how come this is a common problem? But then we started looking in our echo database, in our referral patterns. So most of these patients were not even referred to cardiology or cardiac surgery because the referring doctors thought that this is impossible. This is an 85, 87-year-old guy, he's having aortic stenosis and heart failure, 90-plus-year patient with a lot of comorbidities. It is unreasonable to send him to surgery. So it was very obvious that 30% of the patients with severe symptomatic aortic stenosis were not even referred for aortic valve replacement surgery to even big centers like Cleveland Clinic. We learned that very fast, that there is an opportunity to treat these patients. And now, and we reported that too, that in the first year, we had 150 patients referred to us. This is like when nobody knew that this is successful, this can be done, this can be, and we reported what kind of patients. And you see that most of these patients were, 20% were about 90 years. They had open heart surgery one time before. 15–20% of patients were on home oxygen. Patients had real kidney problems in about 1/3 of the situations. So these are the patients who have other organ malfunction and may or may not be related to aortic stenosis, but just the age that caused other organ failure. And the doctors did not think that it is worth putting this patient through open heart surgery. But as soon as any other option became available, these people were coming out of the woodwork. So we have large number of patients, even today, referred. And we always wonder, if we just look back 15 years and say, what did we do to these patients? And the answer to that is that we never saw these patients referred to us for treatment because people didn't think that there was anything else but medical treatment. And initial experience of ours and others, so UPenn wrote it, we wrote it, to say that 10% of the people in the initial part of our TAVR evaluation died while we were evaluating because we didn't have the option available at, at our own discretion because they were in the trials. So some people qualified for the trials, we had to wait for their approval, this thing, that thing. So all the investigations and all the approvals, by the time they came, we lost 10% of the people. So there is a large number of people who were dying from aortic stenosis even after we recognized. Then we did the randomized trial, and I think we published in Lancet. I was one of the primary authors, lucky to be primary author with partner investigation. And the 5-year data are amazing. So if you look at the partner study, so partner study, which never will be done again, that kind of study, where we randomize patients to having a TAVR or not having TAVR. So these people were TAVR versus medical management, like how we would have managed them if we did not have surgery. So they were not operated. And we had about 150 patients in each arm, 179 to be exact, in each arm. Amazing part is that at 5 years, in the medical therapy arm, without aortic valve replacement, only one patient was alive. So this is a human experiment that is not possible to do it again because it was never done in the past. So Dr. Braunwald in early 70s reported that aortic stenosis is a fatal disease if you don't treat it. But this is from 16 patients that they studied in NIH, and then some other patients that they retrospectively followed. For whatever reason, they didn't have surgery. But at that time, the echo was not that powerful, so we did not know exactly what kind of aortic stenosis they had, what was the exact gradient, what was the exact valve area. In partner study, we had everything. So we knew exactly that they had severe aortic stenosis, they had high gradients, they had comorbidities, and they were symptomatic from aortic stenosis. So the symptomatic aortic stenosis patient's natural history was exactly what Dr. Brownwell predicted, but 50% of the patients died at 1 year, if they were not treated. So the average survival of the patient who were not treated was 11 months versus who were treated was close to 2.5 years, so 30 months. So there was a big difference between the average survival, median survival of the people who were treated with TAVR. And interestingly, only 50% of the patients were admitted to the hospital over 5 years. So people not only got better, not only they survived, but they had a good quality of life. This is very important because when you're 90 years of age, you don't want to, living or dying is not that important as much as it is that you are not burdened to the family, you are not in a nursing home, you are able to do your things. So the quality of life has a huge impact in TAVR population. And now there is scientific data from quality of life assessment that TAVR improves quality of life amazingly.